Hello, I am Deb Coviello, the Drop-In CEO, and I am grateful you've joined us for another amazing episode where week after week I speak to CEOs, C-suite leaders who have amazing backstories. They have insights and inspiration for you. And I do this podcast because I sincerely care about partnering with the C-suite leader to help them navigate their opportunities and challenges with confidence. And oh my, bring on some amazing people with this week, we have James Bates, who is an accomplished CEO, entrepreneur, and board member who has created and led high growth execution for several technology companies. Presently, James is CEO and founder of AdviNow Medical, the world's first artificial intelligence and augmented reality driven automated medical visit platform. He's amazingly accomplished. We're going to let him tell his backstory. I can't wait for him to do that. But oh my, I also realize he is fluent in Japanese, lived in Tokyo for 12 years, has 9 patents. We're going to go into this amazing accomplishments of James. But James, I just want to say thank you for dropping in on the show.
Thank you for having me, Deb. I'm looking forward to the conversation.
Oh, and so am I. And to my listeners, we had a discovery call. And obviously, I'm always looking for leadership insights, career journeys, etc. But we are going to shine a light on what his business offer is in his current role. It is so amazing. It is transformative. I can't wait for him to share his backstory and how he's really making a difference in society. But James, I'm going to hand it over to you to share a bit about your story first.
Sure. Let me start with just a short introduction about myself, and then I'll go into how we founded AdviNow Medical and kind of go through that story. So, James Bates, I'm the founder and CEO of AdviNow Medical. I've been in the high technology field for 30 years. I'm an old guy out in the startup land. Most recent to AdviNow, previous to AdviNow, I had the opportunity to run a billion-dollar business in self-driving vehicle technologies. So we made the technologies that went into Tesla, Google, GM, Daimler, anybody that does auto brake and auto steer. We sold that business, and as an officer of the company, it was a good time for me to retire. So I retired and started to figure out what else I was going to do. The challenge was I had a 2-year non-compete, which meant I can do anything except what I've always been doing. so, so that's always an interesting position to be in. But looking at the whole market, I looked at healthcare and I thought, wow, this is a great opportunity to learn healthcare. Healthcare, as infamously known, is challenged from a cost perspective, a service perspective, and an outcomes perspective here in the United States. We have wonderful inventions. We're the leader in the world in medical technology, but our system is costly. So I figured I would go ahead and learn about healthcare. And my initial thought was, well, I'm gonna buy some medical practices. I thought I would do a roll up, if you will, a mini private equity kind of play. And so I got with a banker and we just started looking at medical practices that were on the market for sale. Well, as I was looking, I was astonished when I would dig into the profit and loss statements and the balance sheet statements of these companies. Excuse me. And none of them were very good businesses. It was really astonishing to me. I did not realize that running medical practices as a business was not good. Now, if you're a doctor that gets paid from it, sure, you get good salaries and but if you actually want to run a business, they don't make a lot of money, low single-digit net profit type of numbers. As a financial investor, you don't want to own those businesses because they don't do anything for you. You could own a lot of practices, but if you're making 1 or 2% profit, you make more money by buying government bonds. So why would you ever buy a business if that's all you make? So as a financial investor, I couldn't bring myself to write a check to buy those businesses. And so I went around to the people that I was doing diligence with and told them that, hey, thanks. I appreciate all the work you've done to providing me the information, but I'm not moving forward, and this is why. Well, one of the guys that I was working with, he ran a chain of 4 urgent cares. He said, look, James, I understand the business is challenged. Why don't you help me fix it? And this was my first opportunity to actually look at healthcare from a financial perspective and not really being from the medical side, I viewed the business as really a manufacturing organization where the widget that's being created is a medical encounter, right? The doctor meets the patient, the doctor treats the patient, and the patient gets better. That service is the widget. Well, the value of that widget per the market is how much the insurance company is willing to pay. Since the majority of the patients have insurance, then you can't decide I'm doing some wonderful service. Essentially, the value you get is exactly what the insurance company will pay and no more. So when you look at it, they're making very little money. So the other thing you have to look at is, okay, what is the cost structure of that such that if this is all the money you're going to get, can we reduce the cost such that it can become a good business? Well, that's when I decided to do what's called a time and motion study. For those of your listeners who have MBAs, I mean, that's where you take a stopwatch and you walk in and you actually measure every motion in the production of the widget. Well, in this case, the widget is a medical encounter. So I start with a stopwatch. I timed exactly how long the front desk person took, what she had to do, and she had to stand up and copy papers. Every single action, the medical assistant, the doctor, the medical biller, the back office, the website person, every single motion inside that clinic was measured. Now, I have to say that the people who were working in that clinic weren't excited to have every single one of their motions measured. Probably nobody in the world would be, but it was almost literally the first time that this had happened to the people who were there. Well, there were a couple of findings out of this study that were very interesting. The first finding was that 70% of the medical visit cost in an urgent care, which is what this was, is the doctor. That means that if the insurance company is willing to pay $100 for that visit, $70 of that $100 goes to the doctor. And you'd say, well, that kind of makes sense. Well, it may make sense, but if your business is that, then you have 30% that you can potentially make profit on, and you're paying insurance and you're paying the medical assistant, you're paying everybody else, which means there's diminishing returns. The business will never be great. So then you dig into, okay, what does the doctor actually spend their time on? And that's where we came to the founding of AdviNow Medical, because the finding that was really interesting was that 67% of the doctor's time that they were spending had nothing to do with their medical licensure. It's, okay, let me fill out this form that the insurance company requires. Let me ask these questions. Let me do this. Not because the patient needs it, but because if they don't do it, they won't get paid. And it's a really, really interesting dilemma that doctors have. They have very, very detailed medical records they have to create, but it's such a pain and so many clicks, so many pages, waiting for the internet that gets stalled sometimes. So much work for them to do that in this clinic, they were actually only spending an average of 3 to 3.5 minutes per patient face to face, but they're spending a total of 20 minutes on the patient. So that means 16 to 17 minutes is spent doing clerical work that they have to do outside the patient room in order to get paid and not get sued. Well, when I looked at all of those activities, I realized that you could actually take that information and an AI could do the majority of that work for the doctor. The AI can engage with the patient, collect all the information, correlate it with illnesses, prep orders, present it to the physician for approval, and the physician can approve it. The AI can code it, document it, scribe it into the electronic medical record, and allow the physician to do what they went to medical school to do. Actually practice medicine like they used to practice 30 years ago, where they would just scribble on a piece of paper. And unfortunately, I'm old enough to remember that. And so the doctor could actually do that again. Meet with the patient, review all the systems, check with the patient, know exactly what they have to say to the patient so the payers are happy, so the insurance companies are happy. But more importantly, be able to have the consultation with the patient so that they feel valued, they actually get better, they have better outcomes. and the doctor isn't wasting all their time on paperwork that has little value for the patient.
Such an incredible story. And I can certainly relate to that, having felt sometimes, even though I know the doctor has best intentions, I feel very much like a transaction. Only if I had a critical issue might I really get their intentional focus on me, and then how fast can I triage and treat. All else, it's like, okay, here's your prescription, or I'll see you in a year from now, making medical care something that should be a little bit more intimate and personal versus feeling like a number, because we know they got to churn out these patients. It's such a sad
Right.
situation, but such an amazing potential solution.
And the whole challenge with the healthcare industry right now is because the profitability is so low in these clinics, the doctors have to sell to somebody, and they don't get very much money for selling their medical practices. So they sell them and they have to continue to work. So they sell them to either health insurance companies or they sell them to hospital systems, right? So those are really the only buyers of medical practices today. Well, when you look at that, why does a hospital system want to buy, let's say, a primary care group? The only reason is because they want to funnel all surgeries to their hospital. So they're trying to funnel the areas that they make money, because that hospital, if it's a primary care doctor, they're going to lose money on every patient that's seen in the old method. So the hospital system puts a lot of pressure on the poor primary care doctors to increase the number of patients each doctor sees. Well, they're not going to pay them more. What they're actually going to do is penalize them and pay them less if they don't meet the targets. So sometimes there's bonuses associated, but most of the time the bonuses are so far out of reach that the doctors are just working 12, 14 hours a day just so they don't get penalized for not meeting the number of patient requirements.
So I'm getting
So as a
depressed.
patient, how does that how does that actually matter to you? Because exactly like you said, the doctor's like, okay, yep. Okay, here's your medicine. Any questions? And you're like, see you next year. Bye. Out of the room. And maybe a nurse comes in to help you and guide you out. But the doctor's bouncing as quickly as they can because they know if they don't meet their targets, they get penalized. Now, when they ran their own medical practices, they could actually make a judgment that says, I want a relationship with this patient. So I'm actually going to sit and wait for them to give me an answer instead of jump out of the room before they can give me an answer, strategically timed. And it's sad for the physicians because they hate it, but it's also sad for the hospital systems. They feel that they must buy these primary care groups so that their surgeries, their hospitals stay full with surgeries because that's actually how they make money. And then you have insurance companies buying primary care doctors so that they can funnel the surgeries to the low-cost contracted
Oh my
surgery
God.
centers that they have. So it's this tremendous game in the healthcare industry, which is very, very sad. And the people who are penalized are the physicians who are trying to do the right thing. So what I love about my product, and now this is going to sound a little bit altruistic, we do want to make money at the same time. But what I love about it the most is that we actually allow doctors to be doctors once again. We allow patients to have relationships with their doctors. And it's not because we're forcing the doctor to go from 14 hours a day to 15 hours a day of work. We let the doctors do a normal shift and go home when it's over because the AI is doing all of that stupid stuff that they should not be doing in the first place.
So your story starts from you exited one part of your career to start something new and found a business opportunity. But on a personal note, whether it's you or somebody you know or somebody else's story, why does this also make sense other than simply it's a better business model for people? Is there a personal connection to making a difference?
Um, yes and no. I mean, I've engaged with the healthcare system my whole life, of course, for me personally, as well as my parents. My mom went through and she had her own issues with the healthcare system, dealing with Medicare rules when she was going through end of life. I mean, she's passed away, but she had Alzheimer's for about 10 years, and dealing with that is just incredibly painful. So anybody who has had that type of experience has that personal experience of knowing that the system is broken, right? We know it's not for the patients. I mean, we had to fight with the hospital to keep her. We had to fight with Medicare when she was on hospice because they had to attach a nurse to it because she had dementia and she was leaving, and all of these weird things that, of course, they don't quite fit in the box. So everything's rejected until you appeal it. And it's, you just know there's got to be a better way. And when I got involved and then I understood the backdrop of how the system works, if you add artificial intelligence to collecting all the data, navigating all those payer rules such that you can actually care for the patient, the system can work. You just need to know how to do it. And the beauty about AI is you can program that into it such that the patient actually gets the outcomes they're supposed to receive.
So let's see if we can maybe visualize this a little bit. Conceptually, I understand that if the doctor or the nurse doesn't have to spend as much time doing transactional work and spending more one-on-one time, what then does this product do? Like, how does it work with obviously not giving away your intellectual property? Just kind of give me a high-level understanding of what this is, because if there's somebody out there that's interested, I want them to get a better feel for how this works.
Sure. So what happens is that when your appointment is coming up, you'll get a text message. And the text message will appear like it's coming from your doctor. You'll never know it's AdviNow, but it'll look like it's coming from your doctor, and they'll say, please complete all of your pre-visit documentation. We've all received those text
Yeah.
messages. It's
Yeah.
called a digital front door. AdviNow has one too. You click on it, and then you'll go through your checking your insurance card, uploading your driver's license, all that stuff that we've all done 1,000 times. What comes after that, though, is a chatbot experience with the chatbot essentially doing the complete interview with you. So that it's asking every question that a doctor will ask you ahead of time. And this is on your phone. The AI is then making a list of all of your orders. Oh, you'll need an MRI, or you're going to need a lab. You're going to need all this stuff. Normally, you would come in, see the doctor, and the doctor would then place all of those orders. Well, the AI is doing this all ahead of time. It's prepping everything for the physician, and the physician's going to approve that, all your orders, before they ever see you. So the beauty is all of that's filled out. The physician approves it. Then we will send you a link to schedule your image, schedule your lab, or whatever you got to do. You're going to go get that information, and then you'll have the appointment with the physician. Once you meet with the physician, you'll walk in the room, and then it will feel like every other encounter that you've ever had, other visit with your doctor. But the only difference is instead of the physician having their head buried in their computer, typing as fast as they can, everything's already there. So now the doctor's looking at it and just reviewing with you the key components of all the information that's in the system. Oh, I see your lab is this, 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 and you answered that maybe your forgetfulness, maybe you're feeling tired all the time, and I'll just use my mother's example, when she was coming down with Alzheimer's in the early days. I mean, that's how it exhibited, is she just say, I'm tired all the time and I forget things. Well, that's kind of how it starts. And the doctor's running through it. Oh, well, we got the MRI of your brain and we see plaque, and then you have those type of conversations. And instead of 5 visits to get to that point, you get to that point in one visit. And the doctor already knows what's paid by your insurance company and what's not. It's the AI has already served it up to them. They don't need to become experts in Medicare A and Medicare B and what it pays and what it doesn't. And for those of you who are at that age, the doctors literally become experts in what the payer will do. And so they don't need to do that anymore. And so instead of discussing about what's going to be paid and what won't, and we'll put up a pre-auth and see what happens, the doctor can just say, hey, this is the next course of action. This is what will be approved by your insurance company. Instead of them figuring it out, it's now a conversation with the patient. And so how does the patient know it's different? They actually get care the first time instead of having to navigate it all themselves for 20 different visits to get to that point.
So we think about the person that is feeling the pain and wants to entertain a conversation about your service. Is it the doctor? Is it the office manager? Is it a hospital system? Who is it out there that maybe curious about what you offer.
So doctors' offices, hospital systems, anybody that does a medical visit. So the AI has a medical record, it will review the medical record, and then the AI will ask the patient a bunch of
So
questions.
not physical therapy or
It could
anything,
be
any
it
medical
could
visit.
be anything. Yeah.
Hmm. Do they have to be a big entity? A little, I mean, like I'm just
No,
thinking like
we
my
support anyone from single doctor practices all the way to large health systems like Mayo Clinic.
Okay, so let's just do challenges and opportunities because I myself when I get ready for a doctor's visit, a lot of stuff is done ahead of time, but not that complete thing. My doctors or nurses are still varied here. So, challenges of this journey that you're on right now. Just curious because
Oh,
it sounds straightforward and everybody should be going for it.
of course. The biggest challenge is large health systems. They're not designed to actually adopt new technologies and take risks. In fact, a hospital system is designed to not take risks. That's how their whole system is designed. And because it's designed to not take risks, adopting any new technology is like an act of Congress, right? It is just a incredibly difficult thing to do. It starts with a small study. There's 27 reviews. You get an IRB, which is a research type of study. Then you'd actually go through another process, and then it goes into a queue. Then you get integrated with the EMR. Then you got to get that reviewed. And so it's literally a 3 to 5 year process for a hospital system to adopt our platform because we do automate all operational and clinical aspects of the visits. So of course they're nervous. They don't need to be, but they are. And it takes a very, very long time. So our biggest problem is that most healthcare entities are not run like businesses. They're not out to solve new problems. They're not out to solve big problems. They're out to do things the way they've always done them. And because everyone's compensated to do that, nobody wants to stick their head up and say, let's try something new, because if it goes great, it's a good performance review. If it goes bad, you're fired. So the
Hmm.
motivation's not there to change. Um, in smaller healthcare practices that are still owned by physicians, that's not true. And so we're seeing broad adoption across those smaller practices. And that's what's going to lead the AI revolution more than large health systems.
Let's just say I or somebody in the audience says, I know somebody. What would be the entry point? Does it contact you? Go to your website just to have that discovery conversation. I'm curious because I know somebody.
Absolutely. You could send them to me. I may refer it to my sales team to get back, and not me personally get back with you, but james.bates@advinow.com. Anyone's welcome to reach out to me, and I'm happy to do that. Obviously, my website's a great place. Info@advinow.com is the general email that's monitored. And so any question you ask going in there, we even have a chat bot on the website that you can engage with. During business hours, you'll get a response. Real time by a real person. And so there's a lot of ways that you can get information. We would love to have you try it out. And one thing we can guarantee you is that your practice profitability will improve. The average profitability change for practices that adopt our platform goes from roughly 3% net profit, which is kind of where most medical practices live, pretty dang low, to over 30%. It's literally 1,000 times better profit.
So you've told me about the challenges of larger entities. Even if they're interested, it's a long road to adopt such change in technology. But let's just talk about those who you have served. What was their situation? Obviously, probably profitability, but what was their situation and what have they shared? Or tell me the story about what the impact is of what you provide, because I think that's really what people want to hear.
Yeah, so one of the first practices to adopt our platform was an urgent care that was 4 locations. Before AdviNow was adopted, they were sitting at about 3% profitability. And the doctors and physicians, they would see roughly about 3 patients an hour. So one patient every 20 minutes. And during rush periods of the practice, obviously they couldn't keep up with documentation, so they'd start seeing more patients, but all they're doing is waiting for the charting to be done at the end of the day. So these were 12-hour clinical shifts. The physicians would work for 12 hours. And then after the shift was over, they'd spent an average of 2 hours every day closing out charts. So that meant when they worked an average of 14 hours a day. And it was usually 3 days on, 2 days off, 3 days on, 2 days off, kind of a normal hospital type of shift. And when you start looking at this, you're just shocked at how much work that they had to do. When AdviNow was adopted, some very interesting metrics took place. The doctors stopped working 14 hours a day and it went to 12 hours a day. The average number of patients they could see per hour was now 6 and not 3. So they were seeing a patient every 10 minutes, yet they were working less hours per day than they were working before. The patient satisfaction numbers went from the low 70s of would you recommend this clinic to your friend to low 90s. So literally 20 points increase in patient satisfaction numbers. Across the board, dramatic improvement. Profitability went from 3% to 36% profitability for that clinic. The revenue per physician almost doubled. The revenue per patient went up approximately 20% because they were coding it appropriately now. So there's a lot of metrics that you actually use to measure clinic health, and every single one improved. The average time it took for a new team member to ramp up pre-AdviNow was 2 weeks. It'd take 2 weeks for a new front desk person or a new medical assistant or a new doctor to come up to speed with all the new protocols of this specific clinic chain. Every practice has their own standard of care. Every doctor needs to come up to speed on it, right? It's just part of the world. Once AdviNow was adopted, because we were enforcing that standard of care, presenting it back to each team member, they didn't need to be trained anymore. So now they can focus on being a good front desk person, being a good face of the clinic. The medical assistant can focus on assisting the provider with procedures and then helping the patient get the actual vital measurements. Instead of collecting all the data, documenting it, remembering where it goes in the EMR, everything is scaled out and served back up to the employees so that they could actually enjoy their job. When you
Well,
think about stress, right?
mhm.
Burnout is a huge problem in the healthcare industry. Well, why is there burnout? Now, you could say it's because I see too many patients. Well, maybe. But due to surveys, what you see is they're actually more stressed about getting things wrong. The burnout is coming from, oh, Medicare, I need to document it this way. Medicaid, I need to document it this way. United Healthcare, I need to document it this way. Aetna, I need to document it this way. I need this code, this code, this code. This pre-authorization form has to be written this way for it to be approved. So doctors are just stressed about doing all this stuff. And if they get it wrong, they know it's just their time, right? They have to go back and do it all over again. It takes twice as much time to get that same thing. The patient's upset because it wasn't approved in time. And all of these things are running through their mind. Once you eliminate all of that and you allow them just to serve patients, it's not about the number of patients. It's about the stress level on every patient.
So let me come back. Thank you for that. So let me come back though then to the practice, because some people, when they hear AI, they're going to say AI runs the world and people are going to lose their jobs. When we think about some of these applications, are people's time, the people that support, the operations, potentially, is there a downsizing, or are we repurposing their skills in other areas of the practice? I'm just curious.
In general, we haven't seen a downsizing. Now, that's because the number of patients goes up. So if your practice does not have an increase in patients, maybe there would be a downsizing. Most of our clients don't have that situation. Most of them are capacity constrained because of the physician shortage that's out there in the world. So once they can see more patients, the staff members are just busy handling more patients, and they're not working more hours. They're actually probably working a little less hours. but it's the whole activity behind it that allows that to happen.
Given time and adoption, while you say that some of the larger entities are behemoths or monoliths that are so hard to change, are you still playing in that space, even though the early adopters are the smaller entities? Because big picture, I heard the expression blue dot, the ultimate outcome. Could this be a complete transformation of the medical system?
Absolutely. I expect within 5 years, nobody will see a doctor without being interviewed by an AI first.
Okay.
I mean, that's just going to be the reality. And it'll be better for the patients. It'll be better for the doctors. It'll be lower cost overall. Everybody wins when that happens. So it will happen. AdviNow is happy to sell into larger entities. Whenever you start, it just takes a long time. So the earlier you start, the faster you get adopted, right? So we're still in the queue at a lot of large health systems. 4 out of the top 10 health systems, are trialing or plan to trial our platform. But it just takes forever. So that isn't our major focus today. Our major focus is smaller practices.
And you probably got a lot more of those than some of these larger healthcare systems. So knowing you can help more people now. So 9 patents, tell me about that.
Yeah, so I have patents from a number of things. From my previous life, it was semiconductors, sensors, radar, things like that. With AdviNow, the patents are fundamental in AI and healthcare. So
Okay.
how the AI engages with the patient, predicts the illness to the doctor approves it, the AI codes it into the electronic medical record. That's one of our patents.
Oh, so amazing. And what brought you? I didn't check all this out, but you're fluent in Japanese and you lived in Tokyo for 12 years. What was that like?
It was fantastic.
Uh,
One of my first jobs out of school, I worked for Bell Laboratories. For those of you old enough to remember what that is,
yes.
of course, AT&T had a research center. They invented the internet. They invented, a lot of inventions, radar, semiconductors. A lot of the early technology development was done when they were a monopoly. And so when I graduated grad school, that was very prestigious. And so I had the opportunity to work there. Well, they sent me to Japan to work in Bell Labs Tokyo. We were working on the world's first digital cell phone chipset, so GPRS chipsets. And so Gen 1, if you will, for now we're on Gen 5, I guess. But that's why I went to Japan from a business perspective initially. And, I just had the opportunity to join a startup after that. And we actually grew the startup from zero international revenue to $500 million of international revenue over the space of about 5 years. And I was in Japan running the international operations for this US semiconductor company. So it was a lot of fun.
And so I'm smiling here because we're going to bring this interview to a close soon. I am just grateful. First of all, I reached out to you, you said yes. And I get to speak to some amazing leaders, have great stories, and are really trying to make a difference in society. So I just want to say thank you so much for dropping in on the show. Any last thoughts before we bring this to a close?
I really appreciate you having me, Deb. I've enjoyed the conversation. And anyone who wants to reach out to me, james.bates@advinow.com. Info@advinow.com for any information that you would like about our product. Obviously, www.advinow.com to go to our website and you can see all the information you need. We're out to allow doctors to be doctors once again, and anyone that we could help enjoy their job again, any patients that we can help get better outcomes, it makes it worth it for us.
James, it's been a great opportunity to speak with you. I wish you well and continued success.
All right. Thank you.